the Toronto Star. I'm Saba Itazaz, and this matters. Reflected in the tragedy of Ontario's long-term care homes during the pandemic was the very harsh image of how we treat our seniors and what kind of life we think they deserve to have. COVID-19 proved to be a revealer of how under-resourced and ill-equipped many Canadian nursing homes were to cope with the crisis. And it also opened up an important conversation on structural and systematic issues within the long-term care industry and the right of senior citizens to a better quality of living. And as the entire system is in a critical stage following the brutal fallout of COVID-19, Ontario has finally opened up legislation on this front for the first time in more than 10 years. To find out what those changes could look like and what is the current state of Ontario's long-term care, I'm joined by Star investigative reporter Moira Welsh. Moira has spent years investigating retirement homes and long-term care facilities. She has also written a book about it called Happily Ever Older. Hi, Moira. Thanks for joining me today.
Hi, thanks for inviting me.
So, it seems that Ontario is about to open up legislation on long-term care finally. Can you draw us a brief picture as to what's the current state of long-term care in the wake of the COVID-19 situation?
I would say that many workers, families, and residents remain traumatized by the experience. And to be honest with you, there's an exodus of workers from the homes, and there certainly isn't across the healthcare system as well, but probably long-term care has been hit quite profoundly by this. So every day, the people who are working there are scrambling in many, many homes. And it's interesting, I recently spoke to a registered practical nurse in a nonprofit home who told me, if you weren't burned out at the beginning of the pandemic, you sure are now. So the human resources issue has been a huge problem. And the same worker said most days, they don't recognize the other workers on shift. They're agency staff who come in to fill in gaps. And that means that they don't know the residents. So as busy as they may be, there are even fewer opportunities now to connect with the people in their care. And on Wednesday, the Ontario government announced that it will be spending a significant amount of money to increase staffing in long-term care, at least initially by 4,000 workers and more in the oncoming years, mostly to meet the average of 4 hours of daily direct care. But the problem is that the system has already lost so many workers. So, in some ways, that's not new workers or additional workers coming in. Some of those numbers will be filling in the gaps of people who've already departed. And there are a lot of questions around that as well in terms of nurse practitioners, if they will be included in the hiring, or some of the other issues related to full-time jobs from workers. That apparently has been left to the homes to determine for themselves. And we know that homes need full-time workers to have proper dedicated care for the residents.
Moira, there was a hope that there would be a sort of deep societal and structural rethinking in the wake of, after the pandemic exposed the vulnerabilities, the issues already existing within long-term care. Did we see any of that happening as you're talking about new legislation, new moves, etc.?
There was a hope, absolutely. And it is happening in a sense because people are talking about ageism and about long-term care, and frankly, about the way that all people will live as they grow older. So before the pandemic, the very large demographic of boomers didn't really focus on long-term care or aging in general, not absolutely in a deep way. But the first wave of that boomer generation started turning 75 during the pandemic. And they watched as their peers or people who are not much older withered in nursing homes. So it was a real confluence of events in a sense that the pandemic came and exposed all these incredible structural problems. And the biggest demographic we've had in modern history, so to speak, started turning 75 at the same time that we were all exposed to that. So when I now talk to groups of older adults, they are fired up, shall we say.
So that's on a societal level, and I'll come to you more for the broader picture on this. Let's first talk about the existing legislation, the Ontario Long-Term Care Act, for example. What are the problems and issues within it that advocates have been highlighting?
A couple of main issues. There are many, but if we look at the bigger pieces that could actually lead to legitimate change, one is the fact that there is absolutely nothing within the Act that requires homes or enable residents to live a life of meaning, purpose, and a life that can help them flourish at any stage. And that's a real problem that needs to be rectified. And absolutely, there are calls for the legislation to be rewritten to really have a strong focus on emotion-focused care or person-first care. And the other piece of it is the fact that the rules are just simply rigid. So homes can't really accommodate the needs of a natural lifestyle of someone actually living in an actual home. So if I wanted to eat my dinner at 4 p.m., that is against the rules. You can only eat after 5 p.m. And if I'm 95 and want ice cream for dessert, even if my dietary plan says I should not have ice cream, the home will probably follow the dietary plan before my wishes.
That's so regimented.
Absolutely. And the regulations are so regimented that, for example, the housekeeper needs to have a post-secondary degree, even though you could find someone who would be remarkable at that job and actually very warm and connected to residents as well. But there are so many limitations around creating a really natural home-like atmosphere.
Would we see any of that flexibility or change in the amendments that might come up in legislation? What's currently on the table?
So right now, from what we've learned from the ministry, their current focus, it appears, is on meeting the 4 hours of daily direct care for each resident and also bringing more, what they could say, accountability and transparency into the Act for homes. So that is what they've discussed publicly. What the industry associations are asking for are a number of different issues, but on the main point that would actually really help transform the culture of care within homes, they're asking that these person-centered or emotion-focused programs be given prominence within the Act, so that homes must have them. And at the same time, they're asking that some of the more minor regulations that limit these options and create a very restrictive existence, essentially, some of those regulations be dropped so that homes have the ability to actually interpret a resident's needs and act upon them.
And those recommendations are currently not a part of the amendments, right?
No, the ministry has just said that it is opening up the Act to deal with those issues that I just talked about. So that's all we know for now, but certainly the industry groups are pushing for a variety of changes, including the ones I just mentioned.
We'll be right back. As you've been talking about right now as well, and you mention in your book, Happily Ever Older, this is technically not about just small administrative or logistical changes even. Does there need to be a bigger conversation about the philosophy behind long-term care through the lens of how society values its elders and what quality of life, frankly, human beings deserve as part of their basic rights? And I was very interested to see you spoke about the concept of freedom in your book and how that relates to long-term care living.
Absolutely. And the reality is that we need a significant change in culture because right now, we as a society, and certainly in long-term care, it's a reflection of that. We look at people who live in the homes as others. They're older, often they're quite vulnerable, and we don't really see them in many ways as people. And that is a real problem because if you're a caregiver, and I'm not saying all caregivers are like this, but certainly the system perpetuates this, that if you're able to look at the people you're caring for and see them as less than you, then they won't be treated well. And at the same time, what's really interesting about that is because the system perpetuates that ageism within homes, it also, in a sense, devalues the workers who care for those residents. And so there's a real belief that if you bring in these new philosophies of care and you uphold the value of the older people, you will do the same for the workers. You will hire people who are emotionally intelligent. You will give them jobs with meaning and the ability to basically make decisions around the emotional needs of the residents, if we're talking about the personal support workers, for example. And so that gives people jobs of meaning. And for my book, when I traveled, all of the leaders who had these programs or philosophies in place said happy workers mean happy residents.
And of course, when you talk about the emotional approach, it would also bring in the angle of culturally relevant care because we have such a diverse senior population here, right?
Absolutely. And that's something that is certainly built into these philosophies and really needs to be expanded across the province. And I think you'll see more of that being discussed as well. But that is a big issue in homes, and even training in terms of just how to relate to certain people. I know there was a home in London, Ontario that brought in the 519 from downtown Toronto to talk about people, for example, residents who were older, but who were trans residents, and allowing the workers to understand their feelings, for example, and to relate to them as the person they believe they were, the person that they were. And so I think that made a big difference in the lives of some of those people. And certainly I heard from the workers too, it really expanded their thinking.
That sounds fantastic to me. So, what's the hindrance? What are the biggest barriers to a vision like that? You mentioned cost as a major one in your book. So, are we sort of seeing that after learning what we learned in the COVID aftermath, that there might be a better allocation and prioritization of funding and money spent by the government?
Well, the government seems to be spending a lot of money right now. And absolutely, the Ontario Long-Term Care Commission into COVID-19 recommended that the government support and fund these philosophies and programs, and there are many, in long-term care homes. And the reality is, does cost really matter at this point? It's not that expensive to add these programs in. And, if you want to look at sort of a return on investment, there's data from a number of different homes that say, that the residents there are calmer. So staff are dealing with less issues. For example, they have more time to spend working and actually caring for people. And there are better opportunities for workers to hire workers and retain workers. And there's a decrease in sick days and a decrease in antipsychotic medication and trips to the hospital. Those are a couple of examples. So while the system may spend more in one way, it also recoups that money in a different way. And at the same time, creates a more humane way for people to live and work.
Right. And some of that stuff is already being tried out here in different ways in Ontario, right? You investigated the butterfly model. If you can recap that for us a little bit. And I do know that the Toronto City Council was planning a pilot project along the same lines. Tell us a little bit more about that.
So the butterfly model came to Ontario in 2017, and the Star published an investigation into the transformation of one small household in the region of Peel in a home called Malton Village. And this program is generally directed at people with cognitive decline, although personally, I think that all residents of homes deserve to have opportunities such as this. But nonetheless, it really changed the way that workers related to people. And there was a lot of intense training that went into it. It isn't something that happens overnight. It takes a lot of work. Not all of the workers wanted to work that way. Most of them did, however. And so it took about 4 or 5 months before we really saw the difference. And so, yes, they painted walls different colors, which they say helps people with cognitive decline find their way around. So they're not just walking down this empty white hallway constantly searching for something. But the paint is just the superficial piece of it. And it really is the connections between workers and the residents. And I would say that with my book, I saw a lot of different programs, the greenhouse model, the Eden alternative. These are all similar philosophies with some differences, but they all uphold the resident and the worker.
As we discussed earlier as well, the assumption was that there would be a sort of national conversation and sweeping change after the horrors we saw during the pandemic. Did that expectation really turn into reality? You've mentioned that we're having conversations around aging now. Talk a little bit about that, and also why is this so important?
It's an evolving reality, I would say. So it's at the beginning, and there are national standards that are being discussed and written now. So we'll see what comes from that. Those standards would be very effective if, in fact, they were attached to funding, which would hold homes and provinces essentially accountable for the way that people are treated in those homes. And there are just other issues as well related to important structural pieces, because There's such a demand from groups like CARP, for example, who say that basically the whole philosophy behind homes, the structure and design, in addition to the philosophy, needs to be sort of ripped apart and rebuilt from the ground up. And I think that's really, really important. The other piece of this is the design of homes, because we know there are studies that show that people have a calmer, more familiar existence when they live in smaller households. And we are still in Ontario using 1991 design standards that call for 32 bed units. And those are really large groups of people living together. Bright lights, lots of noise, and especially if you are vulnerable or have cognitive decline, that can lead to a lot of anxiety, potentially even aggression. So there are many, many different ways that can mitigate some of those issues by giving people what they told me in the Netherlands, a normal life. We didn't live our adult lives with 30 other people. We live in smaller homes, and that is what people are seeking. They're seeking the feeling of home, not the feeling of an institution.
Right. And it's an issue that's going to or does affect all of us. Like you also mentioned in your article that by 2030, 1 in 4 Canadians will be 65 or older. We're all going to be getting there. So it's important to have this conversation over aging now.
It is. And if you think about it, someone said this to me the other day, but the eldest of the millennials will turn 50 in 2030.
Wow. Okay, that's a lot to think about. I'm going to have to think about that. Thank you so much for your insight and for your time, as usual, Moira. Thanks.
Thank you so much.
I was speaking to the Star's investigative reporter, Moira Welsh, and author of the book Happily Ever Older, which you can purchase online or wherever you get your books from. That's it for today. Thanks so much for listening. I'm your host, Sabai Tazaz. The This Matters team is Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bucknick, Raju Muther, and Sean Pattenton. Our music is by So-Called, Mike DeAngelis, and Sean Pattenton. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.